our Office of Emergency Management Manager, Mark Flathouse. Why we are here? It was a long journey. March 4th of 2020, we had our first COVID case in Stafford, which happened to be also was the first case in state of Texas. That is more than 2 years ago. We came a long way. Today, I am so happy to see that we are in a level where pretty much we started, but I just wanted to be very clear. COVID is still here. COVID is not 100% gone. And we will continue to inform you what is happening. And I always said this, I am all about transparency and communication with our public. And so any changes happening in the threat level, any changes happening either way, whether it's good or bad, it is my job to let you know. And today we have good news. I'm going to be lowering our risk level from yellow, which is moderate community risk, to green.
Buenas tardes a todos. Gracias por estar aquí presentes. Estoy aquí para anunciar de que estoy disminuyendo el riesgo de amarillo a verde. Estamos aquí juntos con nuestros administradores y como siempre yo les he dejado saber que hablo con transparencia para comunicar a nuestra comunidad. Hoy es un buen día porque estoy emocionada del futuro de Fort Bend County, ya que estamos regresando a la normalidad. Como ustedes recuerdan, tuvimos nuestro primer caso en Stafford, Texas. Es el primer caso en el estado de Texas.
And as I mentioned before, we came a long way. And from day one, we decided that it is important we take COVID virus seriously. And it is heartbreaking for me to see that, we have to, with the stroke of a pen, we have to shut down the county for the sake to save lives, which we did. And after that, we all went to work as county judge and HHS and all we went to work. And when we had tests available, we focused on testing every corners of Fort Bend County, and we came a long way, and we always stayed on the top per capita basis testing in state of Texas. Out of 254 counties, we were always in the top 5, and sometimes it is number 2, number 1, and we always stayed in the top 5.
Y como ya digo, hemos emprendido un largo camino, ya que por todos nuestros esfuerzos, las medidas que hemos tomado de los 254 condados, hemos emprendido un camino muy arduo. Hemos llegado muy lejos. Siempre estamos en el nivel 2 o en el primer nivel, ejerciendo este puesto, abriendo muchos sitios móviles para nuestros residentes.
And also then eventually we had a vaccine available. When the vaccine became available, we also knew it is vaccinating the most of our citizens are the best way. We are going to deal with this pandemic, and that is exactly what we did. We opened vaccination centers throughout the county. And we are also today, I'm very proud to say that we are on the top when it comes to the most vaccinated citizens in state of Texas. Also consider we are the 10th largest county with getting almost close to 900,000 people.
Y como ya dije, hemos hecho lo mejor, tomado las mejores medidas. Cuando llegaron las vacunas, tomamos medidas muy grandes para vacunar a todas las personas. De hecho, estamos en primer lugar de vacunar a todas las personas en el estado de Texas. Así que tomamos medidas muy arduas para vacunar a todas las personas posible.
And I just wanted to say this, this is a combined effort. This is a team effort of our medical community, our hospital system, our clinics, and all our medical partners, and we partnered with Fort Bend County HHS. This is a combined effort, and I just wanted to make sure these all our partners we worked very closely with. They all played a major role in accomplishing this goal of vaccinating the most people in Fort Bend County.
Incluso estamos en colaboración con nuestro personal médico, nuestros servicios de primeros auxilios, las emergencias médicas. Todos estamos en colaboración para asegurarnos de que todas las personas del condado de Fort Bend están siendo cuidadas al nivel en cual estamos tomando medidas muy arduas, estamos tomando medidas serias y para así asegurarnos que todos estén vacunados en el condado de Fort Bend.
Sure. And we accomplished this by using, as I mentioned, vaccine location. Even we had mega vaccine location and pop-up sites for maybe a church site and things like that. Then we went and purchased a mobile unit, a lab on wheel. And thanks to our EMS, we even took vaccine to our citizens who didn't have mobility. They are bedridden or for various reasons they couldn't even travel. We took those vaccines to their homes. And so we did everything possibly we can do to accomplish this goal of vaccinating the most citizens in Fort Bend County.
Y gracias a las medidas en colaboración con el Departamento de Servicios de Emergencia, llevamos a las vacunas a las gentes, la población más vulnerable. Incluso hicimos instalaciones móviles, íbamos a las iglesias, a diferentes lugares para así asegurarnos de que las personas estén siendo, no solo que les hagan las pruebas, sino que estén siendo vacunadas.
And I just wanted to thank once again, I said this earlier, but I just wanted to thank our EMS, and thanks to our residents, and thanks to our frontline workers and hospitals, of course, hospitals and medical personnel, our clinics. Every one of those organizations played a role accomplishing this goal, and also I wanted to repeat this again, our residents. They went and got vaccinated, and thanks to them too, that's why we are able to accomplish what we accomplished today. And so I will get into some numbers so then you could take it from there. Because of this effort, where do we stand today? 87% of Fort Bend County residents 5 and up got at least one shot in Fort Bend County, and 78% of 5 and up is fully vaccinated in Fort Bend County. Almost 99, almost 100% of our 65 and up at least got one shot of COVID vaccine. 97% of 65 and up is fully vaccinated. That's incredible accomplishment, and like I said, as a team, we are able to accomplish.
Y de nuevo quiero agradecer a nuestros trabajadores de servicios de emergencia. Incluso quiero agradecer a los trabajadores de primeros auxilios, los hospitales y nuestros residentes, especialmente nuestros residentes, porque ustedes han ido a vacunarse. Entonces, de veras lo agradecimos. Y dado esas medidas en colaboración, hemos logrado el 87% de los residentes del condado de Fort Bend que reciban tan solo una vacuna. 78% de edades de 5 para arriba han sido completamente vacunados. Casi el 100% de nuestros residentes de edades de 65 para arriba han recibido una dosis, y el 97% de personas mayores de 65 años han sido completamente vacunadas, gracias a sus esfuerzos.
Sure. Thank you. In this journey, as I mentioned, there are numerous partners, numerous people, dedicated their life into this journey, and one person definitely spent a lot of time working almost 24/7, and working even over the weekend, and times when I called Dr. Minter Sundays and Saturdays and 7, 8, 9, whenever we needed to communicate, we did, and Dr. Minter took this and ran with it, and one person led this effort in Fort Bend County is our Health and Human Services Director, Dr. Jacqueline Minter. I will ask Dr. Minter to come and make some remarks.
En este momento vamos a permitir a la doctora Minter que venga y dé sus comentarios, ya que ella ha trabajado arduamente. Ha trabajado casi 24 horas, 7 días a la semana, los fines de semana, todo sin parar. Ella ha sido nuestra secretaria de Servicios Humanos, la doctora Minter.
Thank you, and good afternoon. As we noted during our most recent public remarks on March 4th, Fort Bend County has aligned our, Fort Bend County Health and Human Services has aligned our metrics with the new CDC Community Impact Guidance that was issued in late February. So using local data, which has been scrubbed for accuracy, we continue to monitor trends in case counts, watch for the emergence and impact of new and old variants, and continue to collaborate with public health, healthcare, and our community partners to provide the best guidance we have for our residents and decision makers. So in accordance with the new CDC guidance, Fort Bend County, along with the majority of the other counties in the greater Houston region, is now in the low impact category. Now this designation is for counties with, first, less than 200 cases per 100,000 over 7 days. Our most recent data shows that Fort Bend County had an average of 19 active cases per 100,000 residents. Number two, less than 10 new COVID-19 hospital admissions per 100,000 residents over a 7-day average. And as of today, on the CETRAC dashboard, Fort Bend County has 3.6 new admissions per 100,000 residents. And less than 10% of staffed inpatient beds occupied by COVID-19 patients, a 7-day average. And as of today, per the CETRAC dashboard, Fort Bend County has 2.7% staffed inpatient beds occupied by COVID-19 patients.
Maybe that give that paper so.
Y desde el 4 de marzo, incluso como ya se ha notado de nuestros comentarios del público del 4 de marzo, el condado de Fort Bend, los servicios humanos, han alineado nuestras matrices con el CDC para las guías que se efectuaron los finales de febrero, utilizando datos locales, cual han sido limpiados totalmente para ser precisos. Continuamos midiendo la tasa de casos, contándolos, el impacto de emergencia sobre los variantes tanto antiguos como los más recientes. Incluso seguimos en colaboración con la salud pública, en nuestro sistema de cuidados, nuestros colaboradores de la comunidad y proporcionando la mejor guía que podemos para nuestros residentes y las personas que toman las decisiones. Conforme las guías del CDC, las nuevas guías para el condado de Fort Bend, junto con la mayoría de los condados en el cruce de la región de Houston, donde hay un menor impacto, esta categoría, se han designado para condados con menos de 200 casos por cada 100,000 casos en los últimos 7 días. La mayoría de nuestros datos muestran que el condado de Fort Bend el promedio es de 19 casos por cada 100,000 residentes. Hay 2 indicadores que determinan el impacto de la comunidad. Menos de 10 nuevos casos, hospitalizaciones de más de 100,000 residentes por un total de 7 días. Como desde hoy, nuestro tablera del condado de Fort Bend tiene 3.6 nuevas hospitalizaciones por cada 100,000 residentes. 10% de los cuartos del hospital han sido ocupados por personas que tienen el COVID-19 en el promedio de 7 días. Como parte del tablero de CETRAC, el condado de Fort Bend County tiene 2.70% de camas ocupadas por pacientes del COVID-19.
Apologize, I would have written them better. These are for me. Sorry about that. Okay, so as I said, each of these data points puts our county and the rest of the Houston region in that low impact category. And as discussed previously, the new guidance does not eliminate the need to protect our populations who are at higher risk for poorer outcomes. We know that we're not yet able to provide protection to our youngest citizens, and we know that the impact, although it appears to be less, when we look at other respiratory viruses, we know that COVID has had a greater impact. We've had about 75 deaths over COVID for our little ones in this area, whereas over the past 6 years, we've had less than 70 deaths for flu with influenza. So in comparison, it's definitely an impact on our community. In addition, our little ones can still transmit COVID to other people, which can pose a greater risk for them as well. So that's not quite on here.
En resumen, aunque nuestros números han bajado, aún estamos cuidando a nuestra población más vulnerable. Son aquellos que no se pueden vacunar, los niños menos de 5 años, ya que tienen la posibilidad de propagar el virus. Y también estamos midiendo los otros virus respiratorios para así prevenir sus hospitalizaciones. Y aunque somos el líder de nuestra comunidad, aún estamos vigilantes para cuidar a nuestra población que son más vulnerables.
So we can now take into account the vaccination rates, the immunity rate due to vaccination or natural infection, and the disease severity and its potential strain on the healthcare system. We do want to focus our efforts on providing good information and maintaining access to vaccinations, including boosters, to all populations who may want that added protection and to spare themselves the potential consequences of long COVID. And we also want to make sure that we have treatment and preventive medicines that are effective and readily available to all who need and desire them.
Y aparte de eso, estamos tomando en medidas las tasas de vacunas, el porcentaje de personas que están teniendo inmunidad por las vacunas y la infección cotidiana, la infección natural, ¿verdad? Incluso el nivel de severidad de la enfermedad y el peso, la carga que le estamos proporcionando a nuestros sistemas de salud. Queremos enfocar nuestras medidas en proporcionando buena información, manteniendo el acceso a las vacunas, que incluyen las vacunas de refuerzo para toda nuestra población y que queremos proteger. Y esperamos ayudarlos sobre las consecuencias de largo plazo del COVID. Incluso queremos asegurarnos de que el tratamiento, los medicamentos preventivos estén disponibles para toda persona que los necesite.
As we watch our cases, global cases rise in Europe and begin to rise also in some parts of the U.S., presumably due to the BA.2 variant of Omicron, we will continue to remain vigilant. We'll watch trends and patterns, and we'll rely on our ability to remain informed, and we'll be prepared to pivot and, as needed, to additional and proven protective measures as we find that need. So, thank you.
Incluso seguimos cuidando la tasa de incrementación que está en Europa y otras partes de los Estados Unidos. Y seguimos mirando la tasa de propagación, tomando las medidas necesarias en como lo necesitemos. Muchas gracias.
Thank you. As I mentioned, we came a long way, and Fort Bend County is in a better shape today because of all this effort, all these partners working together. And so when it comes to emergency, one department worked hand in hand with our Health and Human Services is our Office of Emergency Management. And also we have some weather situation is heading our way, maybe some rain and stuff. To give an update on both, I will invite our Office of Emergency Management manager, Mark Flathouse. Mark?
Incluso queremos agradecer a un departamento específicamente que nos ha ayudado, ha colaborado con nosotros. Incluso nos va a dar un informe de el medio ambiente. Parece que tenemos un frente frío. El señor Mark es el que va a hablar. Gracias.
Good afternoon. First, it's want to say thank you from Office of Emergency Management to the partnerships, to the leadership going through the last 2 years with COVID. It's been an up and down event, but we made it here today to announce that it's going a lot better, but it won't go away, and we need to be very vigilant and to make sure that we move forward on it. The partnerships, not only with our hospitals, with our schools, with our first responders, but even the citizens. It's all been very crucial and an impact to our community, and Fort Bend County is headed in the right direction. In regards to the weather, as the judge mentioned, we do have some weather coming this evening. We want to make sure that everybody is prepared. It's just going to be a storm for potentially this evening with some high winds, potentially hail. They're claiming tornadoes, about a 10% chance of high winds or gusts, which could go into tornadoes. We will be monitoring it. We recommend that you follow us at Fort Bend County OEM. Also maintain, we'll post everything from the weather, so any updates or any flash flooding or anything like that. I'd rather have the citizens of Fort Bend County be prepared going into this evening.
Muchas gracias. Hemos tomado, gracias a nuestras medidas, tanto como los trabajadores de la salud como nuestros residentes, hemos tenido altas y hemos tenido bajas, pero todos trabajamos en colaboración y aún estamos trabajando. Sobre nuestro sistema ambiental, vamos a tener tormentas severas esta tarde. Queremos asegurar de advertir a todos, aunque tal vez no vaya a ser grave, es mejor prevenir. Entonces tenemos el 10% de oportunidad de que se haga un tornado o que haya tornados. Puede haber, va a estar lloviendo y va a haber granizo. Así que queremos que todos estén preparados.
So thank you. Be safe tonight. Maintain communications. Watch social media from Homeland Security, Emergency Management in Fort Bend County, and we'll make sure the correct information is posted throughout the evening. Thank you.
Muchas gracias. Queremos que todos ustedes estén en comunicación, estén mirando nuestros medios sociales. Gracias de la oficina de Fort Bend County en nuestros servicios de emergencia. Gracias.
Thank you, Mark. But I just wanted to reiterate what we are saying here. Lowering our risk level from yellow to green doesn't mean COVID is gone. It is still here, and we are going to live with it and follow all the CDC guidelines and Health and Human Services webpage, and also our social media pages when it comes to Office of Emergency Management, Health and Human Services, and also County Judges' social media pages. We will push out information, whether it is about COVID or the weather, imminent weather situation we are talking about. Please stay tuned. That's where we would be able to communicate with you on a regular basis. And so I just wanted to say here, thank you for coming, and we will continue to inform. And I also, the same way we are informing you the good news, if any kind of this variants or something attack Fort Bend County, we will come and let you know. If we have to raise the threat level, we will do it. But it is all about transparency. It's all about communication. Thank you.
Muchas gracias a Mark. Incluso queremos seguir enfatizando que aunque ya lleguemos a verde, no significa que la pandemia ha terminado. Somos vigilantes, nos queremos asegurar de que estemos protegiéndonos a todos con variantes o variantes que van a salir. Incluso estén al tanto de nuestros medios sociales, nuestra página web, para así informarse, mantenerse informados no solo del medio ambiente, sino de nuestro sistema también en lo de la situación del COVID. Queremos dejarles saber que trabajamos nosotros con transparencia, así que si acaso algún día tenemos que incrementar el nivel de riesgo, lo vamos a hacer, pero les dejaremos saber. Gracias.
Thank you. And with that, that will conclude this press conference. If you have any questions specifically, that can be addressed if you have any. No. And thank you. And I will conclude by saying, protecting our citizens, whether it is COVID, whether it is weather situation, doesn't matter what it is. That's our ultimate goal, and we will continue to do that. We will continue to inform you. Stay tuned for any further update. Be safe out there. Thank you.
Muy bien, les quiero agradecer a todos. Vamos a seguir protegiendo a nuestros ciudadanos, cuidándonos y esténse al tanto de las noticias.